Okay, so I want to show you how to use those optional skull opening worksheets. Again, like I've mentioned before, those openings or foramen within the skull are very complicated and probably the most confusing and hardest part of learning the skull. So if you notice on those optional worksheets, there are two different sheets. One is an internal view, and all of the foramen are grayed out on here. So we're going to start here with the internal view, and just to give you a perspective on where you are, this is the anterior side of the skull, this is posterior, and this opening is the foramen magnum. Now let's do the bones just so we know where we are in anatomical position. So this would be the frontal bone, ethmoid with the cribriform plate, the sphenoid bone here in the middle. This would be temporal and temporal on the left and right. And last but not least, containing the foramen magnum and forming this little neck, joining temporal and sphenoid together, is our occipital bone. So from there, we can go through and name the openings within the skull. So let's start anterior and work our way posterior. So the anterior-most opening that we're seeing in this image and in a skull is long and slit-like inside the sphenoid bone. So these two are your left and right superior orbital because they come out in the orbit, and fissure because they're a slit-like opening. So these are your superior orbital fissures. Now if you were to stick a pipe cleaner through these would be in the posterior wall of the orbit. So that same slit-like opening you see from the anterior view. The other opening that we see entirely in the sphenoid bone is this perfectly round opening here, and again there's left and right. These are your optic canals. Now it's a canal because it tunnels a little bit through the sphenoid bone, and this is the opening that allows your optic nerve to run from your eyeball towards your brain. So these two are optic canals. Inferior in the sphenoid bone, kind of right in the middle of the sphenoid bone. Now this bone marking here would be the lesser wing, this would be the greater wing. So kind of in between the lesser and greater wing, you see almost a perfectly round hole. This one is called the foramen rotundum, and rotund because it should be perfectly round. So the foramen rotundum. Now the foramen rotundum, if you stick a pipe cleaner through, will come out just inferior or below the orbit. The last two openings that we're going to look for, I always refer to these as Batman and Robin, just because we can see them on both inferior and internal views, and they're always the same appearance and in the same position. So the first one is the easiest one. It's bigger and it's oval in shape. So we call this one the foramen ovale. Easy enough. And the Robin to the foramen ovale's Batman is this little tiny opening called the foramen spinosum. Now there are a lot of openings just because of location within the sphenoid bone. The next opening that we're going to look at as we work our way posterior is considered a junctional hole. And it's junctional because it lies between three bones where they come together. So here's sphenoid, occipital, and temporal bones. This opening is known as the foramen lacerum. And I always tell students, you don't have to say it the absolutely correct way. Say it how you're going to spell it. And the foramen lacerum laces all three of these bones together. So you can think of it that way too if you find that helpful. Posterior and a little bit lateral to the foramen lacerum, the next opening you see is called the carotid canal. And this allows your internal carotid artery to come up from your neck and provide arterial blood to your brain. So carotid canal on left and right. If you look directly posterior between the temporal and occipital bones, you'll see our second junctional hole. This guy here kind of looks like a jelly bean, is the jugular foramen. And the jugular foramen is where our venous blood through our internal jugular vein comes out of our brain. So jugular foramen is a junctional hole between occipital and temporal. The last opening that we're going to look for on the internal view can be found within the walls of the foramen magnum. So if you see your foramen magnum, again, spinal cord, and it's where the medulla oblongata is going to end and the spinal cord is going to start. In the lateral walls of the foramen magnum, the last little hole is the hypoglossal canal. It's a little tunnel, and it carries your hypoglossal nerve that goes to the back of your tongue. So hypo under and glosso tongue.